Welcome to today's episode. We are going to talk about one of the most serious health challenges in the world today, lung cancer. Lung cancer is not just another illness. It is the leading cause of cancer-related deaths worldwide, claiming the lives of nearly 1.8 million people each year, according to the World Health Organization. That's more than breast, prostate, and colorectal cancers combined. Think about that for a moment. This single disease takes more lives than 3 of the most well-known cancers put together. So why is lung cancer so deadly? Part of the answer lies in its silence. In its earliest stages, lung cancer often produces no noticeable symptoms at all. And when symptoms do appear, they often resemble much milder conditions. A persistent cough may be dismissed as a lingering cold. Fatigue is written off as stress or lack of sleep. Shortness of breath is blamed on aging or being out of shape. Because these signs are so ordinary, people delay seeking help, and by the time the disease is diagnosed, it's often advanced. Research highlights this tragic reality. The American Cancer Society reports that if lung cancer is diagnosed at stage I, the 5-year survival rate can reach 60% or higher. But when it's discovered at stage 4, the survival rate falls to below 10%. That gap is enormous, and it shows us one thing very clearly: early detection saves lives. But to detect lung cancer early, we need awareness. We need to understand the warning signs, the subtle clues our bodies give us when something is wrong. According to clinical reviews published in journals like Thorax and the Journal of Thoracic Oncology, many patients experience signs and symptoms for months before being diagnosed. Unfortunately, because these signs mimic other conditions, they are often overlooked. In this episode, we are going to go through what lung cancer is, the different types that exist, and the 20 major warning signs you should never ignore. We'll explore each symptom, why it happens, and what the science says about its importance. We'll also discuss how these signs, when taken seriously, can lead to earlier diagnosis and better outcomes. It's important to remember that having one of these symptoms does not automatically mean you have cancer. Many of them can be explained by other, less serious conditions. But when these symptoms persist, change, or combine, they become red flags that demand medical attention. My goal in this episode is not to alarm you, but to empower you with knowledge. By the end of today's discussion, you'll be equipped to recognize the key signals of lung cancer, signals that, if acted on early, could make all the difference between a late discovery and a life-saving diagnosis. What is lung cancer? Lung cancer begins in the tissues of the lungs, most often in the cells lining the airways. Our lungs are like 2 spongy organs that bring oxygen into the body and remove carbon dioxide. Inside them are tiny air passages and sacs, all lined with delicate cells. When these cells are exposed to harmful substances, like tobacco smoke, radon gas, asbestos, or other pollutants, their DNA can become damaged. Over time, these damaged cells may grow and divide uncontrollably, forming a mass of tissue called a tumor. What makes lung cancer particularly dangerous is its ability to spread quickly. Cancerous cells can break away from the original tumor and travel through the bloodstream or lymphatic system to other parts of the body. This process is called metastasis, and it's why lung cancer is so deadly. By the time many people are diagnosed, it has already spread beyond the lungs. According to the World Health Organization and the American Cancer Society, lung cancer accounts for nearly 1 in 5 cancer deaths worldwide. It is the most common cause of cancer death in both men and women. Types of lung cancer. Lung cancer isn't just one disease. Doctors classify it into 2 main categories, based on how the cells look under a microscope. These types behave very differently, so understanding them is critical. 1. Non-small cell lung cancer. This is by far the most common type, making up about 85% of all lung cancer cases. NSCLC itself has 3 major subtypes. Adenocarcinoma. This is the most common form, especially among non-smokers, women, and younger patients. It usually develops in the outer parts of the lungs and tends to grow more slowly than other subtypes. Because it's located on the edges, symptoms may not appear until the tumor is large or has spread. Adenocarcinoma is also strongly linked to certain genetic mutations like EGFR or ALK, which can now be targeted with modern therapies. Squamous cell carcinoma. This type is strongly linked to smoking. It typically develops in the central airways, near the bronchi. Because of its location, it may cause earlier symptoms such as a persistent cough or even coughing up blood. Squamous cell carcinoma counts for about 25 to 30% of all lung cancers. Large cell carcinoma, this is less common but more aggressive. It can appear in any part of the lung and grows and spreads faster than adenocarcinoma or squamous cell carcinoma. Because of its rapid growth, symptoms often appear suddenly and progress quickly. 2. Small cell lung cancer. Although less common, making up about 10 to 15% of cases, this type is much more aggressive. It's almost always linked to heavy smoking. Small cell lung cancer tends to start in the central airways and spreads rapidly to other parts of the body, including the liver, brain, and bones. One unique feature of small cell lung cancer is that it is often associated with paraneoplastic syndromes. These are conditions where the cancer produces hormone-like substances that affect the whole body, leading to symptoms such as muscle weakness, confusion, or hormonal imbalances. While SCLC usually responds well to chemotherapy and radiation initially, it often returns quickly, making the prognosis more challenging. Less common types. While non-small cell lung cancer and small cell lung cancer make up the vast majority, there are also rarer lung tumors. Carcinoid tumors. These are slow-growing and often found in younger patients. They may release hormones that cause unusual symptoms like flushing, diarrhea, or wheezing. Mesothelioma, a rare cancer that affects the lining of the lungs, often linked to asbestos exposure. It's different from the more typical lung cancers but is equally serious. Why types matter. Understanding the type of lung cancer is important because it guides treatment. Non-small cell cancers may be treated with surgery, targeted drugs, immunotherapy, or a combination. Small cell cancer, because of its rapid spread, is usually treated with chemotherapy and radiation rather than surgery. The type also affects symptoms. For example, central tumors like squamous cell and small cell often cause cough, wheezing, or coughing up blood early. Peripheral tumors like adenocarcinoma may grow silently for a long time and only cause symptoms once they spread. Now that we understand what lung cancer is and the different types it can take, the next question is, how do we recognize it? This is where things get tricky. Lung cancer is often called a silent killer because its symptoms in the early stages are subtle, ordinary, and easy to dismiss. A cough, fatigue, chest pain, these can all be brushed off as minor problems. But when they persist, change, or appear together, they become warning signs that something much more serious may be happening. In the next part of this episode, we'll go through 20 warning signs of lung cancer. I'll explain each one in detail, why it happens from a medical perspective, and what research says about its importance. Remember, not every symptom means cancer, but every symptom deserves attention if it does not go away. Awareness is the key to early detection, and early detection saves lives. 1. Persistent cough. A cough is one of the most common health complaints, but it is also one of the most underestimated warning signs of lung cancer. Normally, a cough caused by a cold, allergies, or mild infection clears up within a few days or a couple of weeks. But in the case of lung cancer, the cough often lingers and refuses to go away, lasting for 3 weeks or more. According to the American Lung Association, between 50 and 75% of people eventually diagnosed with lung cancer reported having a chronic cough before their diagnosis. This cough may sound different from the ordinary kind. In some cases, it starts as a dry, tickling cough. In others, it produces mucus, which may become more frequent or thicker over time. Smokers often face an added challenge because they may already have a daily smoker's cough. For them, the key sign is when that cough changes, when it becomes deeper, harsher, or more persistent than usual. Research published in the journal Thorax shows that many smokers who developed lung cancer first noticed a change in their normal cough pattern. Doctors emphasize that this change should not be ignored. If a cough lasts longer than 3 weeks, resists ordinary treatment, or changes in quality, it should be evaluated with a chest X-ray or CT scan. While not every lingering cough means cancer, it is often the earliest and most consistent signal the body gives. 2. Coughing up blood, hemoptysis. Coughing up blood, even in small amounts, is one of the most dramatic and concerning warning signs. The medical term for this is hemoptysis, and while it can be caused by infections such as tuberculosis or bronchitis, In many cases it is linked to tumors in the lungs. Blood appears when cancer erodes delicate blood vessels in the airways. A study in the Journal of Thoracic Disease found that around 20% of lung cancer patients experience hemoptysis at some point in their illness. Sometimes the blood shows up as streaks in the sputum, other times as clots. Even if the amount is tiny, it should never be brushed off. Doctors strongly advise that anyone who coughs up blood, even once, should be checked immediately. If it happens repeatedly, it becomes an urgent red flag. The seriousness of this symptom lies in timing. While other causes may be treatable, blood in sputum is often one of the first visible signs of lung cancer. Waiting to see if it goes away risks allowing the disease to spread further. Clinical guidelines recommend that unexplained hemoptysis, no matter how minor, be followed with diagnostic imaging to rule out cancer. 3. Shortness of breath. Shortness of breath, or dyspnea, may not immediately raise alarms because people often attribute it to aging, being out of shape, or stress. But when simple activities, like walking to the kitchen, climbing a single flight of stairs, or carrying groceries, suddenly leave someone gasping for air, it is cause for concern. Lung cancer can cause breathlessness in several ways. A tumor may grow large enough to block or narrow a major airway, preventing normal airflow. Cancer may also lead to pleural effusion, which is a buildup of fluid in the space around the lungs. This fluid restricts expansion, making breathing feel shallow and incomplete. The National Cancer Institute notes that shortness of breath is one of the most frequently reported symptoms among patients with advanced lung cancer, but it may appear earlier depending on tumor location. What makes this symptom dangerous is its subtlety. Many people adjust their routines, walking slower, resting more often, avoiding stairs, and don't realize that their activity level has decreased because of a health issue. If breathlessness appears suddenly, worsens without explanation, or interferes with normal daily life, it should be investigated promptly. 4. Wheezing. Wheezing is usually associated with asthma, but in adults who have never had asthma before, it can be a warning sign of something much more serious. Wheezing happens when air struggles to pass through narrowed airways, creating a high-pitched, whistling sound. In the case of lung cancer, tumors may partially block the air passages or press on them from the outside, causing that distinctive sound. The Cleveland Clinic stresses that unlike asthma-related wheezing, which often improves with inhalers or medication, cancer-related wheezing tends to persist. Research in Chest Journal has shown that new-onset wheezing in adults, especially those over 40 with a history of smoking or exposure to pollutants, should immediately raise suspicion for lung disease, including cancer. One of the difficulties here is that people often dismiss wheezing as a temporary irritation or even blame it on aging lungs. Family members sometimes notice it before the patient does, hearing the whistling sound when the person exhales. Because wheezing is such a familiar symptom, people assume it's harmless. But new wheezing, especially when it does not respond to standard treatment, is a sign that requires imaging tests to rule out lung cancer. 5. Chest pain. Chest pain is another signal that often gets mistaken for heartburn, pulled muscles, or even anxiety. In lung cancer, the pain is usually persistent and may worsen when coughing, sneezing, laughing, or taking deep breaths. According to research published in Stat Pearls, up to half of lung cancer patients report some form of chest pain. This pain can occur when a tumor grows near the lining of the lungs, known as the pleura, or when it presses against the chest wall or nearby nerves. Unlike muscle strain, which typically improves with rest, lung cancer-related chest pain continues over time and may intensify. Some patients describe it as a sharp, stabbing pain, while others feel a constant pressure. The challenge is that chest pain has many possible causes, some minor and some serious. But persistent, unexplained pain should always be investigated. For doctors, one clue that points toward lung cancer is when chest pain is accompanied by other respiratory symptoms such as cough, wheezing, or shortness of breath. Together, these create a strong clinical picture that something more than a simple muscle ache is at play. Warning sign number 6, hoarseness or voice change. A persistent change in the voice can sometimes be one of the earliest signs of lung cancer, yet it is often overlooked. Normally, voice changes are associated with infections like laryngitis or with overuse, such as shouting or talking for long periods. These types of hoarseness usually improve within days or weeks. But in lung cancer, hoarseness can last far longer and steadily worsen. The reason lies in the anatomy of the chest. The recurrent laryngeal nerve, which controls the movement of the vocal cords, passes very close to the lungs. If a tumor presses against or invades this nerve, the vocal cords cannot function properly, leading to a voice that sounds raspy, weak, or hoarse. According to the American Cancer Society, prolonged hoarseness that does not improve within 2 weeks should always be taken seriously, particularly in people at higher risk for lung cancer. While voice changes may seem harmless at first, they are one of the body's ways of signaling that something more serious could be happening internally. Any hoarseness that persists and is not explained by infection should prompt a medical evaluation. 7. Frequent infections. Repeated chest infections, such as pneumonia or bronchitis, can be another sign of lung cancer. Normally, infections clear up with antibiotics and supportive care. But when they keep coming back in the same part of the lung, it suggests there may be a structural problem. In lung cancer, a tumor can partially or completely block an airway. This obstruction prevents mucus from draining properly, and stagnant mucus becomes a breeding ground for bacteria. The Mayo Clinic emphasizes that patients who develop pneumonia more than once in the same lung area should be checked for cancer. While recurrent infections can occur for other reasons, such as weakened immunity or chronic lung disease, their repeated appearance, especially when focused in one location, is an important red flag. Doctors often order a chest CT scan in these cases, since an X-ray may not always show the hidden tumor behind the infection. 8. Unexplained weight loss. Unintentional weight loss is one of the most recognizable warning signs of cancer in general, and lung cancer is no exception. Many people with lung cancer lose weight quickly without making any changes to their diet or lifestyle. This happens because cancer cells consume large amounts of energy and also release chemicals called cytokines that interfere with the way the body processes food and stores nutrients. The result is rapid weight loss and loss of muscle mass, a condition called cancer cachexia. The National Cancer Institute reports that more than half of patients with lung cancer experience significant weight loss before or at the time of diagnosis. The amount may vary, but losing more than 10 pounds in a few months without trying is considered medically significant. Unlike ordinary weight loss from dieting, this loss feels unexplainable and often continues despite eating normally. Doctors caution that while many illnesses can cause weight loss, in adults, especially those over 40 with a history of smoking or exposure to environmental toxins, it must never be ignored. 9. Loss of appetite. Closely connected to weight loss is the loss of appetite. Lung cancer often changes the way the body regulates hunger. Tumors release inflammatory substances that disrupt normal appetite signals in the brain. As a result, people may feel full quickly, may lose interest in meals they used to enjoy, or may eat far less than usual without realizing it. According to a review published in the Journal of Thoracic Oncology, around 60% of lung cancer patients report appetite loss at diagnosis. In many cases, this symptom appears before weight loss is noticed. What makes it concerning is that appetite usually does not return even after rest or recovery from minor illnesses. If someone goes weeks without their appetite returning, and especially if it happens alongside other symptoms such as fatigue or coughing, it is an important sign that should not be overlooked. 10. Unusual fatigue. Fatigue is one of the most underestimated symptoms of lung cancer. Everyone feels tired occasionally, whether from work, stress, or lack of sleep. But cancer-related fatigue is different. It is profound, persistent, and does not improve with rest. People often describe it as a feeling of being drained or exhausted even after light activities. Research from the American Lung Association notes that up to 80% of lung cancer patients report fatigue at some stage of the disease. This exhaustion is caused by a combination of factors: the energy demands of the tumor itself, the immune system's constant effort to fight the cancer, and in some cases, anemia or nutritional deficiencies linked to the illness. Fatigue becomes especially concerning when it interferes with daily activities, when climbing stairs, preparing meals, or even holding a conversation feels exhausting. Because fatigue is so common in everyday life, it is easy to dismiss. But persistent, unexplained fatigue lasting more than a few weeks should always raise concern, particularly when combined with other warning signs. 11. Shoulder or arm pain. Shoulder or arm pain might not seem like a lung-related issue at first. Most people would think of arthritis, a pinched nerve, or maybe a sports injury. But research shows that a certain kind of lung cancer, called a pancreas tumor, can grow at the very top of the lungs and press on nearby nerves. This pressure leads to persistent pain in the shoulder, which may radiate down into the arm or hand. According to the Cleveland Clinic, pancreas tumors are relatively rare, but their symptoms are distinctive. Patients often describe the pain as deep, constant, and resistant to ordinary painkillers. What makes it tricky is that because the pain is felt in the shoulder or arm rather than the chest, diagnosis is often delayed. In some cases, this pain is the very first symptom that brings patients to a doctor. Imagine a person who keeps thinking they have a frozen shoulder or a stiff neck from working long hours at a desk. They try physical therapy, they try rest, but nothing helps. Months later, a scan reveals that the pain was not from the muscles at all but from a tumor pressing on nerves near the spine. This is why unexplained shoulder or arm pain, especially when it does not improve with standard treatment, should always be taken seriously. 12. Swelling in the face, neck, or arms. Swelling in the face, neck, or upper arms can sometimes be a dramatic and sudden warning sign of lung cancer. This happens because a large tumor can press against the superior vena cava, the major vein that returns blood from the head and arms to the heart. When that vein is compressed, blood flow slows down, causing swelling and sometimes a bluish discoloration of the skin. The American Cancer Society identifies this as superior vena cava syndrome, a condition that often develops with small cell lung cancer, which grows rapidly in the central chest. Along with swelling, patients may notice visible veins on the chest, headaches, or dizziness, especially when bending forward. This is considered a medical emergency because the blockage can worsen quickly. Picture someone who suddenly finds that their face looks puffy in the morning or that their shirt collar feels tighter than usual. They may think it's water retention or an allergic reaction, but in fact, it's the result of a tumor pressing on one of the body's largest blood vessels. Because of its seriousness, any unexplained swelling in these areas should be checked urgently. 13. Difficulty swallowing. Difficulty swallowing, known as dysphagia, may seem like a problem linked only to the throat or digestive system. But lung cancer, especially when it grows near the middle of the chest, can press on the esophagus, making swallowing painful or difficult. The National Cancer Institute lists dysphagia as a recognized symptom of advanced lung cancer. Patients may describe the feeling as food sticking in the chest or complain of pain while swallowing. At first, the symptom may only occur with solid food, but as the tumor grows, even liquids may become difficult to swallow. One patient in a clinical study published in Lung Cancer Journal said that they avoided eating because meals had become uncomfortable, leading to rapid weight loss. This illustrates how one symptom can feed into others, like weight loss and fatigue. Difficulty swallowing that persists or worsens, particularly in adults with risk factors like smoking history, should always be evaluated with imaging and endoscopy. 14. Bone pain. Bone pain is a strong indicator that lung cancer may have spread beyond the lungs. The bones most commonly affected are the spine, ribs, and hips. Research published by the National Center for Biotechnology Information, NCBI, shows that 30 to 40% of patients with advanced lung cancer develop bone metastases. This pain is not like ordinary muscle soreness. Patients describe it as deep, aching, and persistent, often worse at night or when resting. Unlike arthritis or back strain, which may improve with movement or medication, bone pain from cancer tends to grow steadily worse. Sometimes, the first sign of bone metastasis is a fracture caused by weakened bone structure. Imagine someone who has lived with mild back pain for years, suddenly noticing that the pain has become constant and much more severe. Despite using pain relievers and rest, it only intensifies. Later, imaging reveals that the cancer had spread silently to the bones months earlier. This is why persistent, unexplained bone pain must always be taken seriously in the context of lung health. 15. Headaches, dizziness, or seizures. Lung cancer does not always stay in the lungs. In many cases, it spreads to the brain, causing neurological symptoms such as headaches, dizziness, balance problems, or even seizures. The American Cancer Society reports that 20 to 40% of lung cancer patients eventually develop brain metastases, making these symptoms important warning signs. The headaches linked to lung cancer are often severe, persistent, and different from ordinary tension or migraine headaches. They may be accompanied by blurred vision, nausea, or sudden changes in coordination. Dizziness can also appear due to increased pressure inside the skull. In some cases, seizures are the first symptom that brings a patient to the emergency room. Consider this: a person who has never had migraines suddenly begins experiencing daily headaches that wake them at night or worsen when they bend forward. They may try to treat it with over-the-counter painkillers, but nothing helps. Later, brain imaging shows tumors that spread from an undiagnosed lung cancer. This is why any new, persistent neurological symptoms should always prompt investigation, particularly when combined with respiratory warning signs. 16. Swollen lymph nodes. Swollen lymph nodes are something most people associate with a simple infection, like a sore throat or a cold. In those cases, the nodes usually feel tender and shrink back down once the infection passes. But with lung cancer, the swelling is different. It often shows up in the lymph nodes above the collarbone or on the side of the neck, and unlike infection-related swelling, these nodes are usually firm, painless, and persistent. Why does this happen? Lymph nodes are part of the body's defense system, filtering harmful substances and fighting infection. But they also act like checkpoints where cancer cells can spread. In lung cancer, tumor cells can travel through lymphatic vessels and lodge in nearby nodes, causing them to enlarge. According to the Mayo Clinic and the National Cancer Institute, lymph node involvement is common in lung cancer and is often one of the earliest signs of disease progression beyond the lungs. Imagine noticing a small, firm bump just above the collarbone. It doesn't hurt, and it doesn't go away after weeks. You might think it's nothing, maybe just a swollen gland. But doctors emphasize that swelling in this area should always be evaluated, because it may be the body's first visible clue of a hidden lung tumor. Persistent lymph node swelling is never something to ignore. 17. Persistent chest tightness or pressure. Chest tightness is a vague symptom, and that's what makes it dangerous. Many people blame it on anxiety, heartburn, or muscle tension. But in lung cancer, the sensation of heaviness or pressure in the chest can signal that a tumor is pressing on surrounding structures or that fluid has collected in the pleural cavity around the lungs. Unlike sharp pain, which people tend to take seriously, this kind of chest tightness often feels dull and constant. Research summarized in StatPearls describes lung cancer patients reporting it as a band-like pressure or weight on the chest that never seems to lift. It doesn't come and go with meals like indigestion and doesn't improve with antacids. Instead, it grows slowly and steadily worse. One of the biggest problems with chest pressure is that people often adapt to it. They start breathing shallower, moving less, or convincing themselves it's stress. But when chest tightness lingers for weeks or months, it's an unmistakable sign that something is interfering with normal lung function. Doctors recommend that any unexplained chest tightness, especially when paired with cough or shortness of breath, be checked immediately with imaging. 18. New-onset asthma-like symptoms. Asthma is usually diagnosed in children or young adults. So when someone in their 40s, 50s, or 60s suddenly develops asthma-like symptoms, doctors become suspicious. These symptoms may include wheezing, repeated coughing fits, and difficulty breathing. While they resemble asthma, the underlying cause may be something far more serious. In lung cancer, tumors can irritate or partially block the airways, creating the same whistling and breathless effects seen in asthma. But here's the difference: true asthma typically responds well to inhalers and steroids. Cancer-related pseudo-asthma, as some researchers call it, often resists these treatments. The Cleveland Clinic warns that if adult-onset asthma does not improve with standard medication, further testing such as CT scans should be performed to rule out lung disease. Picture a person who never struggled with breathing issues before but suddenly starts waking up at night with coughing fits. They're prescribed an inhaler, but it doesn't bring relief. The cough and wheeze remain. This persistence, especially in older adults, is a red flag. New asthma-like symptoms in later life are not common and always deserve a deeper look. 19. Jaundice. Jaundice is usually linked to liver disease, but it can also be a late sign of lung cancer when the disease spreads to the liver. The yellowing of the skin and eyes happens because the cancer interferes with bile flow, causing a buildup of bilirubin in the blood. The National Cancer Institute identifies liver metastasis as a common complication in advanced lung cancer. Patients with jaundice may also notice other symptoms like dark urine, pale stools, itching, or abdominal swelling. While these signs point directly to liver dysfunction, the root cause could be cancer that started in the lungs and spread silently through the bloodstream. The appearance of jaundice in someone with other respiratory symptoms is especially concerning. Imagine someone who already has a persistent cough and unexplained weight loss suddenly noticing their eyes turning yellow. At that point, the disease has likely moved beyond the lungs. Doctors emphasize that while jaundice is not usually an early sign, its presence is a strong indicator of advanced disease and should be addressed immediately. 20. Clubbing of fingers. Clubbing of the fingers is one of the more unusual but classic signs associated with lung disease, including cancer. Over time, the fingertips become rounder, larger, and bulbous, while the nails curve downward, giving them a shiny, spoon-like appearance. This doesn't happen overnight. It develops gradually, often unnoticed until the changes are obvious. The exact cause of clubbing is not fully understood, but scientists believe it is related to long-term low oxygen levels in the blood and the release of growth factors from the tumor that affect blood vessels in the fingers. The American Cancer Society notes that while finger clubbing can appear in other lung and heart diseases, its presence alongside symptoms like cough, chest pain, or weight loss strongly suggests a serious underlying condition. In medical history, finger clubbing has long been considered a sign of chronic lung disease. Physicians often check nails and fingertips during exams because this subtle change can reveal a hidden illness. While not every lung cancer patient develops clubbing, when it appears, it is a clear physical marker that should never be ignored. Lung cancer is one of the most challenging diseases of our time, not only because of its aggressiveness but also because its symptoms are so easy to dismiss. A persistent cough, a bit of fatigue, or a change in appetite may not seem alarming at first. But as the research shows, these ordinary-seeming symptoms often mask something far more serious. Recognizing the 20 warning signs we've discussed, from cough and shortness of breath to swelling, jaundice, and finger clubbing, can lead to earlier detection, earlier treatment, and ultimately better chances of survival. Remember, these symptoms do not always mean cancer, but they should never be ignored if they persist or worsen. If you or someone you know is experiencing any of them, seek medical advice promptly. Early diagnosis can make the difference between life and death. Thank you for joining today's episode. Stay informed, take care of your health, and share this knowledge, because awareness saves lives.